Welcome, everybody, back to Health Matters, brought to you by Cipla. I'm your host, Ryan O'Connor, and she is back, ladies and gents. Another episode of Health Matters SA, joined again by the phenomenal Dr. Zenda, widely known as Dr. Gynae, Joburg-based OB-GYN sexologist, founder of We See You, as a fellow of the European Committee of Sexual Medicine. Dr. Zenda obviously continues to break stigmas and lead transformative conversations around women's reproductive health across South Africa. Now, in this episode, we unpack the often confused but critically distinct conditions of PMS, premenstrual syndrome, and PMDD, premenstrual dysphoric disorder. What they are, how they differ, and why it matters that we recognize the signs. Many women experience emotional and physical changes before their period, but for some, these changes are so severe that they disrupt their daily lives. And that's where understanding the difference becomes life challenging. Now, whether you're personally impacted or want to support someone who is, this episode empowers you with clarity, compassion, and of course, clinical insights. Doctor, welcome.
Thank you. Thank you. This is always fun, educational, and such a pleasure. Thank you for having me.
Absolutely. Now, what is the difference between PMS and PMDD?
So PMS, premenstrual syndrome, about 70% of women are likely to experience this. It is both symptoms that are physical, in the sense of things like, for example, bloating, tenderness of breast. They may or may not experience premenstrual cramps. The more psychological symptoms are finding fluctuation of mood. Some ladies may experience more depressive symptoms, but some may even experience more anxiety type of symptoms. Now, this generally happens as a result of, when you look at how our cycle works, around the time of ovulation, which is day 15, all our nice hormones are at their peak. The estrogen, which is the feel good, your testosterone is at its peak, which is more your energy, your sexual drive, your progesterone, which is more on the calm side. But days, probably about 7 to 10 days prior to a period, all of these kind of drop literally to the floor. And this is where these symptoms come from. Now, for premenstrual syndrome premenstrual syndrome, these are very mild. Generally, you can kind of coast along and just use whatever symptomatic things that you may need. It may be a little bit of rest, but you bounce back, especially as soon as somebody starts their period. The big difference with the premenstrual dysphoric depressive symptoms, those ones, they carry on. First of all, they carry on for much longer. So they may begin before the period, but continue throughout into the period. But the other significant thing, and you mentioned it really well, is when it starts to affect the quality of life. So you often find it's generally about 3 to 8% of women may experience these symptoms. The big concerns very often are the depressive symptoms, which then render a person not able to function at work, and sometimes even having something as serious as suicidal ideas. And this becomes important, especially if you're experiencing this every single time your period is about to come. There are treatments that are helpful, should I say. And I think what becomes important is, first and foremost, being aware that you're one of that minority, and then being able to, I call it, anticipate yourself a little bit better, because lifestyle will play a role. The kind of stresses that are in your life at the time will also either make it worse or make it slightly better.
Doc, how common is PMDD? And I guess it's commonly misdiagnosed. Why is that?
Look, I think a lot of the time, because premenstrual syndrome in itself is so common, as I mentioned, about 70% of women will have some of these symptoms, but we often don't know how to differentiate, because one, we don't talk about it as much, and there's often this sort of like stigma, stereotypes that, oh my gosh, she's a monster, it's that time of the month, stay away. And it's kind of thrown around as a very joking, and people never really take it seriously. So the people who experience it, who experience PMDD, I'll be the first one to be like, I'm one of those people. And it is a tough one, because during that time, you really do feel like you could literally diagnose yourself with major depressive disorder. Also, over and above that, it's feeling like, well, I'm going through a period like every other woman. Why should it be why should I make a big hula baloo about it? So then we then don't talk about it. But also when we don't understand that there might be something more than just, a hot water bottle, taking a bit of
So,
rest, eating a chocolate, that will help, and actually understanding that you may have even a hormonal imbalance. I find especially we experience them a lot more in the early stages of the period, so the puberty, as the hormones are sort of like haven't quite balanced out, or commonly also towards the end of your reproductive life, during the perimenopause the perimenopausal phase, because you're still having a period. And what makes this difficult as well is that very often it's just dismissed as, oh, she's in her moods, it's that time of the month. But it is so important for people to be aware. If you are going through symptoms like this, especially that are lasting beyond 2 weeks, then you have a really big problem, and it's important to go get professional help, and also just exclude any other underlying hormonal issues that may be impacting and making it worse.
now, Doc, you talk about those symptoms, some of which are disruptive, and they can obviously affect our daily functioning. Give us some examples that you mentioned. This excruciating pain.
Yeah. So you may experience premenstrual cramps. Generally, very common as well. But I often say, when it comes to pain, as common as it is, it's not normal and it's not okay. It is okay for you to take something for it. Generally, we'll treat with anti-inflammatory pain medication. Also, just using things like heat, hot water bottle helps a lot, because it helps blood flow, and that helps to ease the painful symptoms. And again, when it comes to pain, it's important for people to understand you shouldn't be having excruciating pains more
Oh.
than 2 to 3 days into your period. And even worse, if you're still experiencing the pain even during and after the period, it's important for us to go and have a check and see that you don't have anything like endometriosis
Oh.
underlying. The other common ones, these are sort of like, I wouldn't say light, because they are uncomfortable. It's the food cravings. Suddenly you crave more
Yes.
carbohydrates. It's the tenderness of the breast. It's the feeling bloatedness, and you feel gassy. And again, I'll keep reiterating the importance of a supportive lifestyle, because if you're not eating well, if you're not exercising to get those endorphins, kind of counterfeiting, those depressive symptoms, it feels worse than actually it's supposed to be. The big one we spoke about already is the depressive symptoms, and the worry about this is, at the time when it's happening, people really kind of go into that dark space where there is even a possibility of them harming themselves, and that is something we need to be cautious about. It's also important to always, from our side as clinicians, when a person comes through like with symptoms of PMDD, it's always important for us to screen them for other underlying mental health issues, because anybody who's already suffering with a bit of depression, with anxiety, this will make it worse. And so sometimes you don't even know which one has added to the other. So it really is important for people to know that there is help, and a holistic assessment is definitely necessary to make sure that you are supported and you can actually go through your periods without it feeling like a small nightmare.
Absolutely. And you mentioned so many vital things now, like breaking down the stigma around it, also just brushing off very quickly. Oh, it's in your head what you're experiencing. It's not real. PMDD is real. And it's important for us to have these dialogues and be so open, especially around women's health advocacy. It's crucial.
It's imperative, and it's great that more and more we are having the conversations. I think what is also starting to, people are, I mean, yes, there is social media, there is information, Google from everywhere. It's good to see that women are starting more and more to ask and look out for credible information, accurate information about what's really going on, instead of this sort of like passed on message. Oh, I feel like this during my period. Oh, you must be
Sure.
going, we kind of self-diagnose between each other. It's been really great. I see it in practice. More and more women are coming forth and actually presenting with these symptoms, which is a good thing. But definitely the conversations need to be ongoing. Particularly it needs to be ongoing for the younger girls, because at that stage they also haven't quite figured out their bodies, and to have this over and above can be something that is a bit of a whirlwind as they are sort of like getting to that point of balancing out their hormones. So as parents, to be able to speak to our children about these things and be like, it's actually okay.
Yes.
What can we do to make it better? Do you need space? Let's give you some space. I mean, I remember growing up and strange, because my mom is a retired midwife, but it was almost like it just used to irritate her. It's like, why are you so quiet? Why are you so moody? And now I understand she was going through her own perimenopause at the time. But it also it's not just like disturbing the quality of life of the individual, but also it has impact on the overall family in terms of, well,
Absolutely.
if she's sulking, it's like, just get over it. And that's not how it should be. We should be able to have frank conversations,
Absolutely.
whether it's a young girl, an adult. Do you need time? Do you need chocolate? Do you need touch today? No, I don't. Do you need to go see somebody? Yes, I do. When we feel supported, it makes it 1,000 times better.
Spot on. And we do tend to come from a generational kind of a hand-me-down of misinformation. And it stems from, your mom got it from her mom, got it from her mom. And times have changed since then. We've advanced drastically in the world that we live in now. We have access to information that we never had 10 years ago, let alone 20 or 30 years ago. So moms and dads watching, and I think that the information that you're giving your kids or you're giving your spouse or your partner is one that, my mom went through that. Do not think that you can diagnose what your partner is going through. And about all means, if your partner or your kids or you yourself are in need of medical attention, go and look for it. It is okay. It is okay to talk about it. It is okay to be vocal about it and vocalize what you're going through. And I love that we've got a platform like this where we've got you on board to be able to help people adjust what they're going through, whether it's a lifestyle, nutrition adjustment, whether it's pharmacological support or building these support networks around us, that we know when this happens, we've got a safety net and we're kind of know we're going to be okay. More importantly is we should never, ever stop talking. We should not be ashamed, and we should not keep stigmatizing what it is you're going through. And we love to have these conversations, Doc. More importantly with you, our time flies when we have these, and it seems like we cover a lot of information, but it really is so refreshing to have these conversations with you and to be so open and have these dialogues, because we need to keep having them, not only for those many people that are watching this for the first time thinking, thank heaven somebody's saying something that makes sense to me and I'm not getting it from my mom or my partner, and maybe it's now time to start looking at ways in which you can get the help that you need. And it is readily available. Doc, again, thanks for your time and being a part of another fantastic episode of Health Matters. It is brought to you by Cipla. Don't forget, subscribe to our channel. And if you've missed the previous one with the good doctor, you've got to go and watch it. It's very informative. Health Matters SA for past episodes, future conversations. And until next time, be kind to yourself and never ignore what your body's trying to say.